Now, one of the biggest groups of people who have doubts about getting the vaccine is pregnant women. Tonight, a unique perspective from an expecting mother who says she will not get the vaccine. 10 TV's Bryant Somerville talked with her today. Bryant, what does this all boil down to?
Well, for Danielle Zornes, it boils down to too many unknowns. Could it hurt her? Could it hurt her unborn baby? Could there be long-term effects? What she does want, though, mutual respect for those who share her opinion.
Danielle Zornes is a mother of two, ages 9 and 4. She's also, right now,
yes, tomorrow would be 10 weeks.
About 10 weeks pregnant. To top it off, she's COVID positive.
How long have you had COVID?
I've had COVID for 9 days.
She says she's dealt with fatigue and a cough. Even before this diagnosis, she says she didn't want the vaccine.
So me personally, I'd rather not get it because we don't know any long-term effects.
A personal choice that plays out in the public spotlight.
But do you think that people who choose not to get vaccinated are being looked down upon?
Yes, definitely.
She says just this week she was refused service at an urgent care facility because she wasn't vaccinated.
And the very first question he asked me was, "Are you vaccinated?" And I said, "No." He goes, "Well, that right there is your very first problem."
Her concerns: could the vaccine hurt her? More importantly, could it hurt her unborn baby?
We are recommending that expecting mothers get vaccinated.
Dr. Mona Prasad is a maternal fetal medicine specialist with Ohio Health. She is not Zornes' physician. She understands the questions and concerns, saying she had them too at the beginning, mostly because the first 30,000 women in clinical trials of the vaccine excluded pregnant women. But now,
I think the risk-benefit there definitely weighs in favor of the vaccine.
much has changed. Just this week, a fully endorsed recommendation to get the vaccine came from the American College of OB/GYN and the Society for Maternal Fetal Medicine. Dr. Prasad says the CDC has a registry, 135,000 pregnant women who have received the vaccine. Of that number, she says about 6,000 have been heavily studied, and there have been no safety signals. As for long-term effects, she admits it is an unknown. However,
If you look at vaccines historically, if there's going to be safety signals that exist from them, they occur in that first 8 weeks.
something she says would have been seen during clinical trials before it was approved for emergency use. Dr. Prasad also specializes in high-risk pregnancies. Again, she is not Zornes' doctor, but Zornes says she had a miscarriage earlier this year. All the more reason, she says, to play it safe.
There are going to be people, Danielle, who watch this and say you are not doing what is in the best interest of your baby. When you hear that, how do you take it?
I'll just look at him and be like, well, I get that. Everybody has an opinion, and nobody should be treated different for their opinion.
And I certainly appreciate Zornes sharing her story today, sharing her opinion. As for her personal OB/GYN, she says that doctor has not encouraged one way or the other on the vaccine, recognizing that it is a personal choice. In Columbus, Bryant Somerville, 10 TV News.